Peripheral nerve injuries can result in paralysis and loss of sensation of the segment of the body involved. Personal clinical experiences have shown me the devastating effects that this can have on just about everyone in society. I've seen lawyers, engineers, artists, even scientists lose their livelihoods because they have lost the functional capacity to work. This has measurable economic impacts. In the US alone, nerve injuries are thought to cost around $560 million US healthcare dollars every single year. And all we have to offer these patients is an invasive surgical procedure known as a nerve autograft, the outcomes of which are often really quite disappointing. The past decade or so has seen a number of really exciting advancements made in this field of research, but the translation of this research into humans is still awaited. Rodent models of nerve injury have given us a great insight into the cellular and molecular mechanisms that underpin nerve regeneration, and have also shown the great benefits of new therapeutics, such as nerve conduits, drugs, even new surgical paradigms through which we can treat nerve injury. These have not yet been translated into humans, and I believe that this is largely attributable to the lack of research that has been done to characterize human nerve injury. My PhD brings together surgeons, scientists, radiologists, and neurophysiologists to tackle some of the aforementioned challenges. My PhD benefits from a surgical model and the ethical approval to explore nerve samples liberated during nerve surgery. This has enabled me to explore the cellular and molecular mechanisms that underpin human nerve regeneration. Similarly, there are a number of clinical tests that we can do to characterize nerve injury. Neurophysiology is a clinical test that we essentially do on patients in the clinic. It essentially involves stimulating a nerve and recording the response of the muscle that it innervates. I am working to validate and characterize a novel quantitative outcome parameter to try and estimate the number of nerves regrowing into a muscle. Similarly, I'm taking MR scans of muscles to look at how the volume changes following a nerve injury. And also, as the nerves regrow into that muscle, we want to know by how much bigger do those muscles get. By establishing such quantitative outcome parameters, I'm certain that this will benefit the surgical management of a very heterogeneous and complex patient cohort. More globally, I'm very confident that this will enable the translation of many therapeutics that have shown great promise in this area of regenerative neuroscience into the clinic. Through this multidisciplinary and varied approach to a very complex problem, I'm certain that we can improve patient outcomes. Thank you very much.